Hi viewers, today let's discuss about guided tissue regeneration. This is an important topic. We need to understand this thoroughly. In the last videos we were discussing about the periodontal regeneration and all. This GTR comes under the non-graft associated regenerative therapy. That means here we are not using any graft, but with the help of other procedure, but with the help of other things we do this procedure. So this actually GTR is guided tissue regeneration. The name suggests that it guides the tissue to regenerate. That is the simple explanation of this guided tissue regeneration. This GTR consists of placing barriers of different types like membrane. If you see the picture, this is like a membrane. This acts as a barrier. Why we use this barrier? This barrier is used to cover the bone and the periodontal ligament. See, this is the bone, this is the periodontal ligament. We need to separate this from the epithelium and connective tissue. To cover this bone and the periodontal, this is the bone and periodontal ligament, they have to place this membrane here so that it separates this from the gingival epithelium and also the connective tissue. In the last videos we have discussed, actually this gingival epithelium and connective tissue should not come into the healing site. If they come, means it can cause the root resorption, and also the healing can occur through the junctional epithelium. Our aim is for the regeneration, so we need to place this barrier, and this prevents the epithelial migration, and this prevents this epithelial cells migration into the wound, which favors the repopulation of the area by the cells from the PDL and also from the bone. So this is the major function of this GTR. And how we do this? The procedure is, first we need to raise the mucoperiosteal flap. This is the flap we have to raise. We need to give the vertical incision. This incision extending a minimum 2 teeth anteriorly. If you see this picture, this 2 teeth anteriorly, 1 tooth posteriorly or distally to the tooth being treated. If this is the tooth has to be treated, means then we need to give the incision that has to extend minimum 2 teeth anteriorly and 1 tooth distally. By this method we need to raise the mucoperiosteal flap, and after raising the flap we can see the root, bone, everything. We need to do the debridement and thoroughly plane the roots. We have to do the root planing. And after the debridement, the next step is we have to trim the membrane. This is the GTR membrane. We need to trim the membrane to the approximate size of the area that being treated. Afterwards, what we need to do is that we have to place apically and laterally. Some measurements are there. By following that, we need to place the GTR here. Can you see? Here we place the GTR. After that, we have to suture the membrane tightly. Here, see, the suturing has done. Suture the membrane tightly around the tooth with a sling suture. This is the procedure of this GTR, and we have to see which all are the type of barrier membranes. There are 2 types are there. Non-absorbable barriers are there, absorbable barriers are also there. This is the non-absorbable barriers, because it will not absorb by itself. This is the absorbable ones. This is also divided into 2 natural products. We can use the natural products and we can use the synthetic products. And now we need to understand what are the indications and contraindications of GTR. Indications are, we can use in class 2 percussion and 2 or 3 wall vertical defects. That is important. 3 wall vertical defect means 3 walls are remaining, only 1 wall is missing. So in such case we can do this GTR. If the 1 wall defect means only 1 wall is pending, then that 1 wall is remaining, in that case it is better to use the resection. and if any recession, at that time also we can use this GTR. If we want to preserve alveolar ridge, that time also we can use this GTR. And contraindication are if the tooth is mobile. In such condition we are not supposed to place this GTR, and also the patient is unable to maintain the oral hygiene, and such case also we should not. There are other contraindications are there, so these are the main contraindication. This is all about GTR. I hope you understand this. Thank you.